Welcome, students. Today, the topic for our lecture is on blood plasma and hypoproteinemia. The topics that we will be covering for today's lecture are the constituents, origin of different plasma proteins and their function, clinicopathological aspects of plasma protein, plasmapheresis, and Starling's hypothesis. So, what do you understand by the word plasma? In the last lecture, we have already covered what does blood consists of. Blood consists of plasma, WBC, that is the white blood cells, the RBC, that is the red blood cells, the platelets, the fibrinogen, and the clotting factors, so on and so forth. But now we are concentrating only on the plasma portion of the blood. So if you see this picture, the hematocrit tube that we can see here, you can see the yellow substance, the yellow buffy substance. That is when we centrifuge the blood in a hematocrit tube, what we get, that yellow buffy substance, is nothing but plasma, which is 55% of your total blood. Now, some points that has to be very clearly remembered and the things has to be on your fingertip is that what does this plasma consist of? What is there in this plasma? The plasma is mainly water. 90% of your plasma is nothing but water. Next comes the very important and the most important part is the plasma proteins. 7.1 to 7.4% of this plasma has different plasma proteins. Inorganic constituents is 0.9%, other solutes is 2%. Coming to the next very important features. What are the features of plasma? The oncotic pressure or the colloidal pressure is 25 mmHg, where albumin plays a very major role in exerting the oncotic pressure. So what is the oncotic pressure or the colloidal osmotic pressure? It's nothing but the pressure exerted by the plasma on the capillaries. That is the osmotic pressure. That is 25 mmHg. This value has to be remembered. They come in MCQs, they come in your Viva. They can even help you to, when you write the question, they ask you questions on your theory paper about plasma proteins. This point has to be mentioned. The specific gravity is 1.026 and your buffer action is 0.15, that is 15%, that is 1/6 of the total buffering action of the blood. These three things has to be clearly remembered. The osmotic pressure 25 mmHg, specific gravity 1.026 and the buffer action is 1/6, that is 15% of your total blood buffering capacity. Coming to the next, how to record the volume of plasma, that is how much plasma is there in human body. That is very well explained in this formula. How to know that? Here they are saying that BV, that is blood volume, is equal to plasma volume divided by 1 minus HCT. HCT is nothing but the hematocrit value. That is, this is very important. This has to be clearly remembered, that what is BV? BV is blood volume, which is equal to plasma volume by 1 minus HCT. That is, if you know the patient's total blood volume, how to measure the blood volume, that has been already been explained in the last lecture. So those who have not attended the last lecture, you can go to our YouTube site and see the different formulas for calculating the blood volume. And if once you get a blood volume of the patient, you get the hematocrit value of the patient, you can easily calculate the plasma volume. The standard plasma volume or the normal range of plasma volume for an adult male is 2.5 to 3.5 liters. For an adult female, it is 2 to 3 liters. For a normal newborn, is 280 to 310 milliliters. For an infant, it is 350 to 400 milliliters. And for a child, it is 400 to 600 milliliters. These has to be very clearly remembered. This again very important from an MCQ point of view. Now, many of us have a confusion. What is serum and what is plasma? Now see, serum is nothing but in the plasma, we have the fibrinogen and the clotting factors. If we remove the fibrinogen and the clotting factors, what is left behind is the serum. If you see in this picture in the center of your screen, you can clearly see that the yellow substance is the serum, and this blood clot, which you see red in color, is nothing but your blood clot, and this is the serum. That is, when total plasma, from the total plasma, if you remove the blood clot, you can easily get what we now calling as blood clot. So this is blood clot. When it is removed from your plasma, you get serum. That is what is written in the side beside the photograph. That is, serum is equal to plasma minus fibrinogen and the clotting factors 2, 5 and 7. Coming to the next. What are the different form of plasma proteins that is present? If you see here, the plasma protein is mainly given into 4 forms: albumin, globulin and fibrinogen. Albumin, which is 35 to 50 gram per liter, globulin, which is average 0.85 gram per liter, and fibrinogen, that is 2.2 to 4 gram per liter. Globulins are again classified into 4 types: alpha 1 globulin, alpha 2 globulin, beta globulin and gamma globulins. These are actually 4 categories of globulins, under which you will get some more types or varieties. What are they? If you see this presentation, you will see what are the proteins that comes under alpha 1 globulin. In alpha 1 globulin, you have alpha 1 antitrypsin, alpha 1 anti-chymotrypsin, orsomucoid, serum amyloid A, and alpha 1 lipoprotein. In alpha 2 globulin, we have hepatoglobulin, alpha 2 macroglobulin, ceruloplasmin, thyroxine binding globulin, alpha 2 antiplasmin, protein C, alpha 2 lipoprotein, and angiotensin. Under beta globulin, we have beta 2 macroglobulin, plasminogen, angiotensins, properdin, sex hormone binding globulin, and transferrin. And under gamma globulin, we have IgA, IgG and IgM. This picture has to be clearly and very vividly inscribed in your brain, because this can come as a question in your MCQs, even in your answer sheets you can write it, even during your competitive exams you need it, that which one comes under which category of globulin. So these names has to be very well remembered. If you make it little easier, you can easily find it that whenever you are getting something with the name A, that is A1 antitrypsin, A1 anti-chymotrypsin, serum amyloid A, A1 lipoprotein, these all comes under alpha 1 globulin. Under alpha 2, the names will itself start with alpha 2. Alpha 2 macroglobulin, ceruloplasmin, alpha 2 antiplasmin, alpha 2 lipoprotein, protein C and hepatoglobulin. Beta globulin will have beta 2 microglobulin, plasminogen, angiotensin, properdin, sex hormone binding globulin and transferrin. And gamma globulin will have all your antibodies, that is IgA, IgG and IgM. Coming to the next PPT, where you can easily find, I already told you that what are the different types of plasma proteins: albumin, globulin and fibrinogen. Here are some of the points which are very important, which you need to remember. That's why I've given the heading on your tips. Plasma is the liquid component of the blood, that is 55% of the total blood volume. It is 90 to 92% of the total water and 7 to 8% of proteins, along with salt, hormones, gases and waste products. Clinical significance, that is low albumin equals to liver disease, kidney disorders. High globulin is chronic infections and autoimmune disorders. Low fibrinogen, bleeding disorders. Exam tip, this is very important, which we have mentioned here. Most abundant plasminogen protein, albumin, responsible for the blood clotting fibrinogen, involved in immunity, is gamma globulin. Immunoglobulin or the gamma globulins act as antibodies, act humoral immunoglobulin type IgA, IgG, IgM, IgE. The major plasma proteins, albumin, which is almost 60%, which maintains the osmotic pressure, transport of hormones, bilirubins, and fatty acids. Globulin, which is 36% of the total plasma proteins, includes alpha, beta, and gamma types. Immunity is given by gamma globulin and transport of iron and lipids. And fibrinogen, that is 4%, comes as an essential for blood clotting and converts the fibrin into coagulation. So this picture has to be clearly inscribed in your brain, for this is very, very, very important. Coming to the functions of the various plasma proteins, first is albumin. This is binding and carrier protein and osmotic regulations. So this is very, very important. Next is orthomucoid, that is uncertain. Many have a role in inflammation. Alpha-1 antiprotease, which is also a part of alpha-1 globulin. It helps in trypsin and general protease inhibitor. Alpha-ferritoprotein, that is osmotic regulation, binding and carrier protein. Alpha-2 macroglobulin, which is the inhibitor of serum endoproteases. Antithrombin 3, that is the protease inhibitor of intrinsic coagulation system. Very, very important. Antithrombin 3, protease inhibitor of intrinsic coagulation system. Ceruloplasmin, transport of copper. C-reactive proteins, uncertain. The role is mostly uncertain, but has a role in tissue inflammations to some extent. C-reactive protein, that's what we were getting tested during our COVID times. I think all of you remember. That is the C-reactive protein, CRP, the CRP values were becoming very important. This is nothing but it shows your infection index, how much infection, how much inflammation do you have in your body. That is shown by C-reactive protein. Fibrinogen, we all know, it helps in hemostasis. Hepatoglobulin, this is binding and transport of cell-free hemoglobin. Hemopexin, that is binding to porphyrines, particularly heme for heme recycling, transferring, transport of iron. Apolipoprotein B, assembly of lipoprotein particles. Angiotensin, precursor to precessor peptide angiotensin 2. Protein coagulation factors 2, 7, 9 and 10 helps in blood clotting. Antithrombin C or protein C, inhibition of blood clotting. Insulin-like growth factors 1, mediator of anabolic effects of growth hormone. Steroid hormone binding globulin, carrier protein for steroids in bloodstream. Thyroxine binding globulin, carrier protein in thyroid hormone in the bloodstream. And transthyretin, that is thyroid binding prealbumin, carrier protein for thyroid hormone in the bloodstream. This picture is clearly given in the book The Ganongs. We already know that is a Ganongs review of medical physiology. In that book, this picture is clearly given. If you want this picture separately, or if anyone wants the PDF of the book Ganongs, I have it. We can share it with you. So to get the PDF of Ganongs, you can do DM to me in this video and you will be surely getting it. Coming to the next. Now we know mainly two types of plasma proteins are there. One is albumin, one is globulin. So the albumin to globulin ratio in the blood is normally maintained as 2:1. This is a normal one. So if it at all changes, then what will happen? If the AG ratio changes, the first thing that happens associated with the chronic infections of the liver and causes liver diseases like cirrhosis, kidney diseases, certain cancers like multiple myeloma and autoimmune conditions. When it goes below 2:1, that is 1, when albumin becomes equal to globulin, when will you see that if you get tested, if somebody's blood get tested and you see albumin is equal to globulin, that is their albumin and globulin ratio becomes, then what we can do, we can easily give a differential diagnosis of liver cirrhosis or certain chronic infections or a kidney disease or multiple myeloma like cancer and other autoimmune conditions. If it is high, that is from 2:1, it becomes 2.5, may indicate severe dehydration, a weakened immune system, or a gastrointestinal issue leading to fluid loss. Now, we come to the next very important, that is origin of plasma proteins. Where are they actually formed? In embryo, it is synthesized by the mesenchymal cells and albumin is synthesized first. Again, these points are very, very important. This again can come as your Viva and your MCQs. That's which plasma protein is synthesized first. It is first synthesized is albumin, and where in the embryo it is done in the mesenchymal cells. In the adults, it is mainly in the reticuloendothelial cells of the liver, nothing but the hepatocytes. They are mainly produced in the hepatocytes. And also from your spleen, from your bone marrow, disintegrating blood cells and general tissue cells. But mainly it is from the reticuloendothelial cells of the liver. And gamma globulin is synthesized from the B lymphocytes. So these are very, very important. So the alpha 1 and the alpha 2 and the gamma globulins, they are mainly produced in the mesenchymal cells in case of embryo. Albumin and globulin are in the adults, they are given by the reticuloendothelial cells with liver, along with spleen, bone marrow, disintegrating blood cells and general tissue cells. Coming to the next slide, we will get what are the functions of these plasma proteins. The functions of the plasma protein is suspension stability of the blood, to maintain the fibrinolytic actions of the blood, to maintain the osmotic pressure so that the mineral depositions and the mineral absorptions becomes normal, to control the blood viscosity. Obviously the blood viscosity is very important for both oxygenation of the and to remove the carbon dioxide, which is very important. Coagulation of the blood, the most important thing. Defense mechanism of the body because of the presence of the immunoglobulins, transport function, reserve proteins, acid base balance of the body, very, very important to maintain the acid balance base of the body, nourishment of the tissue cells and genetic informations. So these are the in general functions of the plasma proteins. So at least if you can write these points down on your exam sheets and you can explain at least 2 to 3 lines regarding each, you can easily make a very good descriptive answers. So I will go through again what are the functions: suspension stability of the blood, fibrinolytic functions, osmotic pressure, blood viscosity, coagulation of the blood, defense mechanism of the body, transport functions, reserve proteins, acid base balance of the body, nourishment of the tissue cells and genetic information. Now I will show you in this how is actually the albumin synthesized and how it is used. So from the hepatocytes, which is the reticuloendothelial cells of the liver, what we get is prealbumin. In this prealbumin gets converted into the proalbumin. Everything this is happening in the hepatocytes. Inside the hepatocytes, we will get prealbumin. From there, we will get something known as the signal peptidase will use on it and it will change into albumin. The proalbumin on action of furin will produce something as prealbumin. This pre-proalbumin, again I'm telling you, from inside the hepatocytes, the pre-proalbumin will get converted into signal peptidase, that is proalbumin, and on the actions of the furin, it will form pre-proalbumin. This pre-proalbumin will go into the intervascular space. That is 40% of it will go into the intravascular space. From where it goes in two ways. It goes into the intermuscular space, which is 60% of that will go into intermuscular space. Some part will go into the lymphatic system and some part will go degraded through muscles, kidney, liver and GIT. So at least if you can draw this diagram, practice this diagram very well so that you can write clearly from how it is produced and how it is degraded or it is absorbed in the body. So this diagram is very, very important from synthesis of albumin. Next point. Now we already know there are three things: albumin, globulin and fibrinogen. So albumin and globulin, what are their concentration, what is their volume and everything. Now something we will discuss is hypoproteinemia. Because we know that what are the proteins are there, what should be their ratio, if their ratio is changed, what will happen, what are the reasons for their ratio change, how much they should be there, what are the percentages, where it is synthesized, we know that. Now we will know the clinico-pathological aspect. That is, if it reduces, when the protein level reduces, what does that indicate in the body? And if it is increases, what does that indicate in the body? Before that, you have to understand something what is known as hypoproteinemia. Hypoproteinemia is nothing but the reduction of the levels of proteins, which results mainly from malnutrition, liver diseases, intestinal diseases, and kidney diseases. So when does this level of protein goes down? Either it goes down due to malnutrition, liver diseases, intestinal diseases, or kidney diseases, which results in, this results from, these are the causes of hypoproteinemia. What happens if hypoproteinemia happens because of any of these reasons? What are they going to happen? What effect will it happen on your body? That is reduced plasma oncotic pressure, especially due to the reduced albumin concentration and edema formation. I already told you that is the pressure. What is the osmotic pressure or oncotic pressure? It is the pressure exerted by the blood on the capillaries. So when the oncotic pressure is disturbed, obviously the interstitial fluid, the plasma will flow into the interstitial fluid, that is from higher concentration to lower concentration. When the pressure changes, higher pressure, when it changes, diffusion happens, it will get accumulated in the interstitial spaces and it causes edema. So edema formation will happen, depression of specific functions will happen, that is reduction in globulin will reduce your immunity, that is reduction in the resistance to infection, reduction in the fibrinogen will cause the defective blood clotting. So this is very clear picture that if hyperproteinemia, that is when the protein level goes down, it mainly goes down either because of malnutrition, it may be because of the liver disease, it may be because of the intestinal diseases, malabsorption, kidney diseases, and loss of albumin in the urine, which results in reduced plasma oncotic pressure, especially due to reduced albumin concentration and edema formation, depression of specific functions, that is reduction in the globulin, reduction in the resistance to infections, and reduction in the fibrinogen, that is defective. Next is, what are the different types of hypoproteinemia? It can be pan-hypoproteinemia with hypoglobulinemia and hypoalbuminemia. Okay, so it can be both. It can be reduced albumin and reduced globulin. Hypoproteinemia with hypoalbuminemia and normal globulin concentration. It can be the globulin goes down, where the albumin goes down, but the globulin remains same. The third type is where the globulin concentration goes down, but the albumin remains the same. Fourth one is normal total protein concentration with hypoalbuminemia and hyperglobulinemia, less commonly hyperalbuminemia and hypoglobulinemia. So what happens? What are the different four types? Where you can see both have reduced. Your albumin level have also reduced, your globulin level have also reduced. Or it can be albumin level has gone down, but your globulin level is normal. Third type is your globulin level have gone down, but your albumin level is normal. And the fourth type is where you can see your albumin level have gone down, but your globulin level have gone up, which is very less commonly seen. Among this also there is one more, that is your albumin level have gone up and your globulin level have gone down. This is very, very important. Here, this chart will give you very clearly, this is when and what these things happens. When these things happens, or when does these things happen? If you see this, the first thing is total protein. When does it increase? That is hyperproteinemia in case of dehydration, in case of hemolysis, in case of acute infections, in case of respiratory distress syndrome, in case of excess of glucocorticoids, in case of leukemia, in case of rheumatoid arthritis and alcoholism. When does the decrease? In case of hypoproteinemia, that is hypoproteinemia happens in case of diarrhea, hemorrhage, burns, pregnancy, malnutrition, prolonged starvation, cirrhosis of liver, chronic infections like chronic hepatitis or chronic nephritis. So mainly hyperproteinemia happens when normally your water level in your body goes down. That is dehydration, your water level goes down. Hemolysis, when your red cells are breaking, when your blood is red cells are breaking. Hemolysis, it's breaking. Acute infections, respiratory distress syndrome, excess of glucocorticoids. Hypoproteinemia in case of diarrhea, when you have loss of fluid loss in your body, burns, pregnancy, malnutrition, hemorrhage. When you have lot of fluid loss in your body, you get hyperproteinemia. When does this albumin increase? Mainly in case of dehydration, excess of glucocorticoids and congestive cardiac failure cases. So albumin, that's why you'll see when you go to a cardiac patient, if you see the reports of a cardiac patients, you will get your plasma proteins checked. Your albumin level, your globulin level is very clearly checked. So the albumin and the globulin levels are checked in case of cardiac patients so that you see if there is any congestive cardiac failure. So in case of congestive cardiac failure, your albumin level will increase. When will it decrease? In case of malnutrition, in case of cirrhosis of liver, in case of burns, in case of hypothyroidism, in case of nephrosis, and in case of excessive intake of water. When does this globulin increase? In case of cirrhosis of liver, chronic infections, nephrosis, and rheumatoid arthritis. It decreases in case of emphysema, acute hemolytic anemia, glomerulonephritis, and hypoglobulinemia. This fibrogen, it increases in case of acute infections, rheumatoid arthritis, glomerulonephritis, myocardial infarction, stroke, and trauma. It decreases in case of liver dysfunction, use of anabolic steroids, and use of phenobarbital. The albumin to globulin ratio, it normally increases, which I have already described before, is hypothyroidism, excess of glucocorticoids, hypogammaglobulinemia, intake of high carbohydrates or protein diet, and it decreases in case of liver dysfunction and nephrosis. These two charts you have to remember. These charts are very, very important. These has to be in your fingertips. So now we have seen when it happens. Now, how will you understand that your albumin level have gone up? When you will understand that my albumin level have increased or decreased? You know, it happens because of dehydration, because of congestive heart failure, or because of cirrhosis of liver. But what are the signs that you are having your albumin concentration up or down, or your globulin concentration has gone up or down? You will have edema, you will have thin and fragile hair, you will have dull skin, your hormonal imbalance will start, poor musculature, loss of muscle mass, and high infection risk. These are the 7 points. The 7 points are very, very important. Edema, thin and fragile hair, dull skin, hormone imbalance, poor musculature, loss of muscle mass, and higher infection risk. So, next will come something known as plasmapheresis or Whipple's experiment. What is plasmapheresis? It is nothing but we take out the blood from your body. There is a plasma separator in the machine where the plasma gets separated, and from there we do the corrections required in your body. That is, if something is wrong in the plasma proteins, with the help of plasmapheresis, we can actually do certain corrections in your plasma proteins. This is mainly done for the treatment of myasthenia gravis, thrombocytopenic purpura, paraproteinemic peripheral neuropathy, paraprotein, and Guillain-Barré syndrome. So very, very important. Plasmapheresis or Whipple's experiment is done in case of myasthenia gravis, thrombocytopenic purpura, paraproteinemic peripheral neuropathy, paraprotein, and Guillain-Barré syndrome. Some of the other clinical pathologies regarding the plasma proteins are nothing but your plasma cell neoplasms, monoclonal gammopathy, multiple myeloma, heavy chain diseases, hypercalcemia, impaired immunity, amyloidosis, the POEMS syndrome, and Waldenstrom's macroglobulinemia. The descriptions of each and every diseases that are written over here, that much details cannot be covered in one video, so this will be again dealt in the later videos. But the first thing you have to remember, you have to know the names. If you know the names, it becomes easy. Then what are the diseases that can be caused due to the problem in the plasma proteins? If this comes as a question and given 4 options, you should know at least these names: plasma cell neoplasm, monoclonal gammopathy, multiple myeloma, heavy chain diseases, hypercalcemia, impaired immunity, amyloidosis, the POEMS syndrome, and the Waldenstrom's macroglobulinemia. So what are the treatments that can be given for these type of things? Because these are mostly because of defective in the synthesis of the plasma proteins, or because of defect in the genetic problems or genetic coatings. So what is then? You can go for radiation therapy, you can go for thrombolytics, Thrombolytics are thrombin and platelet factor 10 activity are both decreased by heparin. It is used to treat both pulmonary embolism and deep vein thrombosis. Cyclosporin, one of the most significant calciurine inhibitors, it is frequently utilized during transplant surgeries and chemotherapy. So radiation therapy, thrombolytics, cyclosporin and chemotherapy, these are mainly used for the treatment of these diseases such as plasma cell neoplasm, monoclonal gammopathy, multiple myeloma, heavy chain diseases, hypercalcemia, impaired immunity, amyloidosis, the Poem syndrome, and Waldenstrom's macroglobulinemia. So here we end with this lecture on plasma proteins. I hope these were helpful. To have such type of more videos and lectures, please follow us on YouTube and Instagram. Our official Insta page, Danta Samhita, a friend to all dental students. Thank you.